Good evening and welcome to Chicago Tonight. I'm Brandis Friedman.
And I'm Paris Schutz. On the show tonight.
Sorry won't do. I can't tell my bill collector sorry.
Providers say they're taking care of workers' children through a state program, but they're not getting paid.
Well, nobody support them. So somebody has to start and do something about it.
Enter the Brown Berets, volunteers stepping up to protect street vendors in Little Village.
It's been 3 years since the first COVID case hit Chicago, where we are now in the course of the pandemic.
Reading is fundamental.
And a local nonprofit opens its third location, a decision they say was bound to happen.
But first, some of today's top stories. Live Nation is on the hot seat due to the recent Taylor Swift ticketing fiasco, and a longtime Chicago promoter testified against the company in the Senate today. Jam Productions co-founder Jerry Michelson appeared before the Senate Judiciary Committee. Senators there focused on whether or not the company that owns Ticketmaster is too big and anti-competitive. Jam has long been an independent competitor. Senators grilled Ticketmaster on why online bots bought up millions of Taylor Swift pre-sale tickets, leaving few at face value for actual people. Michelson blames the company itself and says Congress should look at whether it violates federal antitrust laws.
Now Live Nation's going after music theaters and clubs of all sizes in an effort to control the entire live music industry from the top to the bottom. From 2010 to 2021, Live Nation added 61 theaters and 41 clubs to their already large arsenal of venues.
With today's unveiling of the annual Doomsday Clock, scientists say they fear we're now closer to global catastrophe than ever before.
We moved the clock forward the closest it has ever been to midnight. It is now 90 seconds to midnight.
The Bulletin of the Atomic Scientists, based at the University of Chicago, set the Doomsday Clock at 90 seconds to midnight, midnight being global catastrophe. The group says the shift from 100 seconds to midnight, where the clock has been since 2020, is due largely to Russia's invasion of Ukraine and the increased risk of nuclear proliferation. But they also point to continuing threats posed by climate change and biological threats, such as COVID-19.
Online used car dealer Carvana admits it broke the law as part of a settlement agreement reached with the Illinois Secretary of State's office.
Carvana had been illegally issuing out-of-state registration permits to Illinois vehicle owners, and it failed to transfer ownership titles in a timely manner, both violations of Illinois law.
Illinois suspended Carvana's dealership license in May of last year after hearing complaints from consumers. The agreement requires the company, known for its car vending machines, to follow new restrictions, and it allows the Illinois Secretary of State to suspend and revoke the company's license again if it fails to comply.
A newly acquired White Sox pitcher is reportedly under investigation by Major League Baseball over allegations of domestic abuse. The reports say that Mike Clevenger faces accusations he physically and emotionally abused 2 women and his 3 children. Clevenger was signed to a 1-year deal during the offseason after a stint with the San Diego Padres. The team says it was not aware of the allegations when he was signed and says they'll refrain from comment until the investigation is complete.
Snow. It's reportedly still a thing. Ooh. And it's on its way, reportedly. The National Weather Service is tracking a storm set to hit late tonight, with the main snow accumulation starting at 3 this morning through noon tomorrow. So just in time to snarl your morning commute, although not ours because we work late. 2 to 4 inches are expected in the area, with northwest Indiana seeing up to 8 inches. The snow should make a dent in Chicago's snowfall deficit. That's good news, about 10 inches below normal right now, since it's recorded just 5 inches to date. There's more on this story on our website.
Get your snow boots ready.
And coming up in the program, street vendors sounding the alarm on robberies in Little Village.
But first, child care providers across the state say they're not getting paid. Amanda Vinicky has that story right after this.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
Hundreds, if not thousands, of Illinois child care providers are getting by without a paycheck as they await some delayed payments from the state. Amanda Vinicky joins us now with more. Amanda, what is this holdup here, and how many folks are we talking about?
Well, so, Paris, you know, early child care and early childhood education, that is, as well as care, is really important. Of course, it can lay the foundation for kids, and it's necessary for working parents. Those are among the reasons that Governor J.B. Pritzker cited a couple of weeks ago when he laid out a second-term agenda that includes preschool for all Illinois families and expanded child care.
The research is clear. Quality child care affords parents the opportunity to work or attend school and pursue greater economic security. Let's provide more economic security for families by eliminating child care deserts and expanding child care options.
Except the state isn't paying current child care providers on time. The Illinois Department of Human Services, or DHS, did not answer when I asked how many people are impacted by this, but the SEIU union says several thousands. LaTanya Mitchell says she hasn't been paid by the state since November.
We want to be made whole. We demand that a hardship payment also be made to us for our late bills. We are also asking that they guarantee a pay date.
Now, this is not all child care workers and centers in Illinois. This involves those who are part of the state's child care assistance program, in which Illinois pays providers a fee for caring for children from low-income families who are enrolled in it. But DHS says a technical issue impacted payment processing. Provider Deborah Murphy says fixing that is a matter of respect.
If they learn to give us respect, we will have everything we need, because they will know in that respect we want the same things that they want when they get their check. We want to feed our families. We want to pay our bills on time. And we don't want to incur no late fees because of what someone else didn't do. And they look at you and say, oh, well, sorry. Sorry won't do. I can't tell my bill collector sorry.
While daycare centers could be impacted by the delays, the Child Care Workers Union says those are larger businesses and they often are receiving other grants, so they're able to get by. But those who run smaller daycare centers out of their homes are not reimbursed enough. They often don't have savings and can't afford to miss paychecks. Illinois requires daycares to have insurance, but provider Taja Barr says with the delay, she's behind on her bills.
I received a cancellation letter saying that my daycare insurance has been cancellated because I have not been able to pay my bills. As of today, my daycare is not covered and I am in compliance due to DCFS standards. This glitch has been going on for over 2 decades.
Hundreds of child care providers signed a petition to ask DHS to take action. They want a new system so this doesn't happen again. Also, they want hardship payments. DHS did not answer whether either of those are options the agency is working on, instead sending a statement saying that it is dedicating every available resource to addressing the backlog. We have corrected the technical issue, communicated with providers, and are moving payments through the process as fast as possible. We apologize for the hardship this backlog has caused and, as always, are grateful to our providers, the agency says. DHS says that the comptroller has, in fact, prioritized payments to child care providers and that payments, again, will be processed immediately upon receipt by the comptroller's office. But the comptroller says it currently has no delays in paying bills. There's just a regular 9-day turnaround time, and it has 0 child care payments that are waiting to be paid out. Again, providers say this is not the first time they have dealt with a glitch. They, and they're not alone in saying this, say that this is actually a recurring issue, and it's one that child care workers say folks should not dismiss.
Stress relief is because of child care providers. Parents are stress-free because they have qualified daycare providers to take their children to. I have 2 children here and their parents are police officers serving the community of Illinois. If we do not stand together and make sure that our payment system is working for the child care system, then the Illinois workers of Illinois will not be working.
And in fact, the union says that many child care workers got out of the system during the pandemic. Now, this is an issue that does appear to be on its way to getting resolved. Per the comptroller's office, some of the providers, Murphy is among them, have been paid by the state in December as well as this month, though it is not clear if those payments were made in full. In Paris, the SEIU union did not say definitively whether this is going to be something they bargain over, but one would think it is among, so they are due to negotiate a new contract.
We just wonder why these glitches keep recurring. Seems to be an unanswered question there. Amanda, thanks very much.
Thank you.
And now to Brandis and safety concerns in Little Village.
Paris street vendors in Little Village are pleading for help after an increase in robberies. Vendors say this has been going on since last November. They've rallied in front of police headquarters asking for more police presence in the mornings when many vendors are out as early as 4 a.m. selling tamales. As they wait to hear from the city, volunteers are coming together to protect the vendors. Joanna Hernandez has the story.
Street vendors say they are being tormented.
Ya tengo como 13 años vendiendo aquí y nunca nos había pasado eso.
Last week, Margarita Meneses says she was robbed at gunpoint by a group of men.
Me puse como que era así como el shock, ¿qué hago, no? Pero pues ya pues les di lo que tenía yo.
When Angel Valdez heard the Little Village Community Council was looking for volunteers to watch over the vendors, he signed up.
It's amazing how brave they are, you know, because even this happened yesterday, you see them here the next day. That's because they need to provide, just like all of us.
Valdez is a member of the Brown Berets, a national Chicano organization aimed at protecting neighborhoods like Little Village.
To me, it was very important because I know they're very vulnerable. You know, there's people that come from Mexico, from Latin America, and, you know, nobody support them. We have eloteros now, and fruit vendors.
The Brown Beret members take turns with other volunteers, driving around and checking in on the vendors throughout the morning.
We just create a WhatsApp group, and all of them are in it, and you know, they say, guys, be careful.
Along 26th Street, we spoke with Maria Velázquez, a street vendor who says she was robbed multiple times last year.
Caminan, pasan y están un rato con nosotros. En los ratos que estamos más solos, ellos están pendientes, o si no, ellos dicen, aquí estoy en la esquina, estoy más adelante. Y ya nos sentimos, yo me siento en lo particular más tranquila.
But vendors like Velázquez are looking for a plan of action from the city.
Nos dé a nosotros también una respuesta de cómo vamos a continuar. Pero también estamos pidiendo a la alcaldesa que les dé recursos, porque si ellos no les dan recursos a la policía, si no les da recursos, pues la policía va a hacer lo que puede, lo que está a su alcance.
Valdez, who also lives in Little Village, says hiring security is an option.
My opinion is more like to put a group of workers of food doing that full time and get paid. And not by the vendors, by the resources that the city has.
The area's alderman, Byron Cicho Lopez, says the city has the funds to establish a viable solution to protect street vendors.
The city of Chicago just approved one of the largest budgets in the city of Chicago, $16.4 billion. We know also in the latest report that just as little as 10% of the money is being distributed. We need to make sure that those funds are out there to serve our community.
In the meantime, Valdez says they will be out as much as they can to support the vendors.
We're trying to make our voices to be heard, so the mayor and whoever needs to do something about it, they do it. And again, use their resources that they need to be used for this type of things.
For Chicago Tonight, I'm Joanna Hernandez.
And vendors say they'll be meeting with the Chicago Police Department's 10th district for their second time at the end of the month. They say they're hoping CPD has a clear strategy. Up next, the status of the pandemic 3 years after Chicago's first COVID case. What should the city be doing to better support Black Chicagoans who are victims and survivors of hate crimes?
Classic city of Chicago, we work in silos, so the left hand doesn't know what the right hand doing, and the constituents get left out in between.
Power is the voice. The power is the numbers. The power are the people. The ability to sway elections is the power.
It was 3 years ago today that the first case of COVID-19 was confirmed in Chicago. Since then, 4 million people in Illinois have been diagnosed with the virus, and it's killed 36,000 people across the state. While the days of being locked down inside our homes are long over, it appears the pandemic still isn't. Joining us to look at where we are with COVID are Dr. Susan Bleasdale, Chief Quality Officer for UI Health and Assistant Vice Chancellor for Quality and Patient Safety for UIC, and Dr. Samir Vora, Director of the Illinois Department of Public Health. Welcome back to you both. Good to have you in studio, Dr. Bleasdale.
It's nice to be here.
So take us back 3 years ago to this day. First case of COVID-19 in Chicago, only the second case in the country at the time. What was going through your head as a medical professional?
Well, a little bit of anxiety at that point, but I think we were already starting to think about it. You know, in my field, I'm an infectious disease physician. We were already listening to what was happening in China. We were thinking that we need to be ready. We had the first case in Washington State, and we really knew that soon after we would see others pop around the United States, because we're a global economy, we're a global travel, and we were not surprised, but we had a lot that we didn't know yet. And so I think that there was a lot of anxiety and uncertainty, but we learned very quickly. We learned over time, and how things have changed from 3 years ago to now is, I think we've learned a lot on what we need to do to help us to be ready and help us to live with the pandemic, because we're not out.
We're not out. And Dr. Vora, you know, to Dr. Bleasdale's point, you know, fast forwarding to today, where would you say Illinois is now with COVID-19 cases and deaths?
Well, I think, as Dr. Bleasdale said, we are in a much better place. But that COVID-19 took still the lives of 200 Illinoisans in December. And that's more deaths than Ebola took in the entire world. And most of those deaths still are preventable. But I think it's really important for us to carry that we have so many more effective tools now in 2023 than we had in 2020. And even more powerful, we have that knowledge and experience. And we know what can protect us: a vaccine, a timely test, a pill, a mask, that air filter, keeping that window open, or just staying home if sick. And so how do we continue to be vigilant to protect ourselves, preserve hospital capacity, and protect our loved ones, especially those that are most vulnerable for serious illness?
Dr. Bleasdale, would you say we've moved to the point of COVID-19 being endemic? And at what point, you know, would the World Health Organization say the global pandemic is over?
I don't think we're there yet, and I think that, like has been highlighted, there's many things that we've learned, but through this recent respiratory season, we saw significant increases. We saw increases in hospitalization. Thankfully, because of vaccines, we didn't see the same number of deaths that we had seen in previous surges, and so it's important to still highlight that we need people to get vaccinated, to be protected, to improve our hospital capacities, but we're not there yet. We are learning to live with it, but we're not out of pandemic yet. We are still seeing strains and increases on our healthcare systems.
The FDA is looking into beginning to offer an annual COVID vaccine without the requirement of having had that initial dose or that initial series. Similar to the flu, what effect might that have on obviously on the virus and its ability to spread? Would that make it easier to get more people vaccinated?
I think it's going to make it easier to get more people vaccinated, because, you know, the way that the most recent bivalent vaccine was studied as a booster, but it's really just reevaluating it, and it can be evaluated and likely be very safe to be a primary series. It doesn't make sense to get vaccinated against the wild type first strain right now, because that's not what's circulating. We want to very quickly be able to adapt and give vaccine like we give vaccine for the flu, where if it's your first vaccine, it's your first vaccine. It may be that when you start a series, whatever that current series is for the season, we still may need 2 doses to get better protection, but we likely won't need that very first series of the very first vaccines that we came out with.
Dr. Vora, the pandemic, it clearly, obviously, illuminated racial, socioeconomic inequities in our healthcare system. What more changes do you think are necessary to address those inequities?
Well, I think, first and foremost, how important highlighting those inequities is, and I think something that was important to, you know, my predecessor, Dr. Ezike, important to me and, of course, important to Governor Pritzker is really figuring out how we can sort of change the systems in which we think about our health to really promote health equity. And part of that role is to really, one, be able to better communicate to communities around sort of specific challenges, but also open up our public systems and partnerships between public health and healthcare to really make sure that we are serving those that need to be served. And that's a critical mission that the entire health system needs to evolve into. And I think COVID shined that light, and it really put that pressure and that immediacy of doing all that we can to make sure that we're thinking about all aspects of healthcare, from access to communication to prevention to treatment, within that equitable lens, and really focus on those racial, cultural, and socioeconomic disparities.
Dr. Vora, of course, the pandemic forced many of us to adapt and change. What do you think might be some of the long-lasting public health impacts of the pandemic, for better or worse?
You know, I think for better, we did learn so much. You know, the power of data, understanding equity from the beginning of how we design our programs and projects. And then those lessons, I think we were able to adapt, and we were able to think through, although different diseases, in the way that we work through Mpox, formerly known as monkey virus, how we thought about the global challenges around Ebola. But I think one of those things that we do need to continue to learn and do better in public health is around communication, and how we can take some of those lessons that I know we think about, and I know Dr. Bleasdale thinks about clinically, of how we can create those authentic moments to really share the best evidence in the most timely way, to understand where people have questions and concerns and to address them and answer them as effectively as possible, and continue to be honest and transparent so that we can do what we all want to do and keep ourselves and our loved ones healthy. And that's going to take some time. It's going to take some purposeful engagement, but I think it's a real possibility that the future is bright to get there.
All right, that's where we'll have to leave it. My thanks to Drs. Susan Bleasdale and Samir Vora for joining us. Up next, a local bookstore opens a new location for its readers. We take a peek inside right after a look at the weather.
A local nonprofit is celebrating the expansion of its literary reach with a new bookstore in Logan Square. Arts correspondent Angel Ito takes us to Open Books to learn more about its newest Chicago location that's been more than a year in the making.
It's a really great way to be transported into a new world, and you know, it's kind of hard in the current world, so it's nice to take a step back, take some time for yourself, and explore.
That's the mission of the Chicago nonprofit Open Books, to facilitate access to what they say is the basic building block to life success.
Reading is fundamental. I mean, it's a saying that's been around for years, so I don't think I have much more to add to that. The simplest of ideas, to be able to have access to various spaces, to be thinking about all the little places where literacy and reading shows up. That's a huge focal point for us and why we stress the need for reading at all times.
Logan Square is the nonprofit's third Chicago location. Now, the group set its sights on this area after learning many of their shoppers were commuting from the Northwest Side neighborhood.
I've always been a big fan of the West Loop location, and all I ever wanted was one that was closer to me. So it's my favorite bookstore in Chicago. It's the only place I get books. I just find it to have a really good selection, and I am a barista, so I have a small budget. So today I have Why Art by Eleanor Davis, which is my favorite comic artist. I also have Complete Guide to Print and Printmaking, as I am a printmaker.
Open Books says its donation model allows the organization to offer reads at cheaper rates than bigger bookstores. And despite the growing popularity of e-readers and tablets, Open Books says its intended target audience continues to show up.
We want people to be reading however they're reading. Could be old-fashioned magazines, it could be their tablet, it could be the recipe that they are reading with their children as they're cooking in their kitchen. So wherever people find things to read, we want to encourage those habits, especially within homes, and as it impacts children especially, so that they understand what reading and literacy means from an early age.
Their readers agree.
Having something more tangible, there's something about it that helps me connect more to it and retain, rather than looking at it in the screen.
What do you love about reading in general?
I think it's more nostalgia. I used to hate it, thought it was more like a punishment when I was a kid, and now it just calms me.
For Chicago Tonight, I'm Angel Ito.
You can visit or donate any books to any of the Open Books locations in Pilsen and West Loop, and now Logan Square.
And that's our show for this Tuesday night. Don't forget, you can get Chicago Tonight streamed on Facebook, YouTube, and our website, WTTW.com/news.
You can also get the show via podcast and the PBS video app. And please join us tomorrow night, live at 10.
Now, for all of us here at Chicago Tonight, I'm Brandis Friedman.
And I'm Paris Schutz. Thank you so much for watching. Stay healthy and safe, and have a good evening.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that is proud to be a multilingual law firm that provides translators for a variety of languages. Catch your favorite show at a new time, Chicago Tonight. Now every weeknight at 10 p.m. on WTTW.
TV's stand-up stars are back on Pioneers of Television.
We killed ourselves to make those shows as good as they were. We weren't just hanging around.
I wasn't thinking of stand-up or anything. I'd just get these ideas and I'd write them down.
The first time I got a laugh from an audience, I was totally hooked.
And it was at that moment where I just thought, this might work.
Thursday at 7 on WTTW.
Next time.
Save me again.
After Father Brown vows to look after a convicted killer,
I believe he's a changed man.
his friend rejoins a cult.
Astral blessings upon you.
But death soon follows.
What's that on her fingertips?
And guilt is quickly decided.
I'll almost certainly